Clinician's Guide to Laboratory Monitoring of Subcutaneous Testosterone Administration, TRT. Welcome to the official GlobalRPh YouTube channel. We're so glad you're here. If you haven't already, hit that subscribe button to stay updated with our latest videos. Our passionate team is dedicated to bringing you engaging, informative, and easy-to-digest content. Whether you're looking for medical insights, the latest healthcare trends, or fun educational content, there's something here for you. So stick around, be part of our growing community, and get ready for fresh, exciting content coming your way. Testosterone replacement therapy, or TRT, continues to evolve, with subcutaneous administration emerging as a preferred alternative to traditional intramuscular injections. This shift offers improved patient comfort, steady hormone levels, and effective symptom management, making it an increasingly popular choice for managing hypogonadism. To maximize treatment success, clinicians must adopt a precise approach to laboratory monitoring, ensuring accurate dosing, optimal hormonal balance, and minimal adverse effects. This guide provides a comprehensive framework for healthcare professionals, covering the pharmacokinetics, testing protocols, and interpretation strategies essential for fine-tuning subcutaneous testosterone therapy. By integrating the latest clinical evidence and best practices, we aim to equip practitioners with the knowledge necessary to deliver personalized, effective, and safe TRT management. This is the second video of a three-part series. The final video will discuss the major paradigm shift to subcutaneous or microdosing as the preferred route of administration. It is important to note that some overlap and repetition of key concepts will be intentional when discussing the required lab values for both initiation and follow-up. This resource aims to provide a broad framework for healthcare professionals engaged in the management of low T through subcutaneous testosterone therapy. By synthesizing current evidence and clinical best practices, we seek to enhance the quality of care delivered to patients undergoing this increasingly popular form of hormone replacement. Before initiating subcutaneous testosterone therapy, an extensive laboratory assessment is essential to establish baseline values and rule out contraindications. This initial evaluation serves as a foundation for subsequent monitoring and helps guide treatment decisions. Measurement of total testosterone is the cornerstone of hypogonadism diagnosis. It is recommended to obtain at least 2 morning samples, preferably between 7 a.m. and 10 a.m., to account for diurnal variations. The healthcare professional should be aware that reference ranges may vary between laboratories and should interpret results in the context of clinical symptoms. Usual range, 300 to 1,000 nanograms per deciliter. Target for TRT, 500 to 800 nanograms per deciliter. While total testosterone provides valuable information, assessment of free testosterone offers insight into the biologically active hormone fraction. Free testosterone can be measured directly or calculated using total testosterone and SHBG levels. The calculated free testosterone is often more readily available and cost-effective. Usual range 5 to 21 nanograms per deciliter, or 1 to 2% of total testosterone. Target for TRT upper half of the normal range. Sex hormone binding globulin, or SHBG levels, significantly influence the amount of bioavailable testosterone. Conditions such as obesity, diabetes, and liver disease can affect SHBG concentrations, potentially leading to discrepancies between total and free testosterone levels. Measuring SHBG aids in the accurate interpretation of testosterone results. Usual range, 10 to 57 nanomoles per liter. Target for TRT within the normal range. Estradiol. Estradiol levels should be assessed, especially in overweight or obese patients, as excessive aromatization of testosterone to estradiol can occur in adipose tissue. High estradiol levels may contribute to symptoms such as gynecomastia and can affect the overall hormonal balance. The usual range is 10 to 40 picograms per milliliter, with the target for TRT being 20 to 30 picograms per milliliter. Complete blood count, or CBC. A CBC provides information on hemoglobin and hematocrit levels, which are important to monitor as testosterone therapy can increase red blood cell production. Elevated hematocrit is a potential risk factor for thromboembolic events. The usual range for hematocrit is 38.8 to 50%, and for hemoglobin, it's 13.5 to 17.5 grams per deciliter. The target for TRT is within the normal range, preferably in the middle. Lipid profile. Testosterone therapy may affect lipid metabolism. Obtaining a baseline lipid profile allows for monitoring of any changes in cholesterol levels during treatment. The usual ranges and targets are total cholesterol less than 200 milligrams per deciliter, LDL cholesterol less than 100, HDL cholesterol more than 40, and triglycerides less than 150 milligrams per deciliter. Prostate-specific antigen, or PSA. For men over 40 or those with risk factors for prostate cancer, measuring PSA is crucial. While testosterone therapy does not cause prostate cancer, it may accelerate the growth of existing tumors. Regular PSA monitoring is essential throughout treatment. The usual range is 0 to 4 nanograms per milliliter, with the target for TRT being less than 4 nanograms per milliliter and increases less than 1.4 nanograms per milliliter per year. Liver function tests. The usual ranges are ALT, 7 to 56 units per liter, and AST, or aspartate aminotransferase, 10 to 40 units per liter. The target for TRT is within the normal range. Essential laboratory tests for monitoring subcutaneous testosterone therapy. Effective monitoring of subcutaneous testosterone therapy requires a comprehensive panel of laboratory tests. These assessments provide crucial insights into the patient's hormonal status, treatment efficacy, and potential side effects. Healthcare professionals must be well-versed in selecting and interpreting these tests to optimize patient care. The cornerstone of monitoring subcutaneous testosterone therapy is the measurement of serum total testosterone levels. This test provides a direct assessment of the treatment's efficacy in restoring physiological testosterone concentrations. However, it is important to note that total testosterone levels may not always accurately reflect the bioavailable hormone fraction. Free testosterone measurement offers valuable complementary information, as it represents the biologically active portion of the hormone. Calculating or directly measuring free testosterone can provide a more accurate picture of the hormone's physiological impact, especially in patients with conditions that may affect sex hormone-binding globulin, or SHBG, levels. SHBG itself is an important parameter to monitor, as it influences the proportion of testosterone that is bioavailable. Elevated SHBG levels can result in lower free testosterone, potentially necessitating dosage adjustments despite normal total testosterone concentrations. Estradiol levels should be closely monitored, particularly in patients receiving higher doses of testosterone. Excessive aromatization of testosterone to estradiol can lead to unwanted side effects, such as gynecomastia and fluid retention. Conversely, overly suppressed estradiol levels may negatively impact bone health and libido. Hematocrit and hemoglobin measurements are crucial for assessing the risk of polycythemia, a potential complication of testosterone therapy. Regular monitoring of these parameters allows for timely intervention if erythrocytosis develops. Prostate-specific antigen, PSA testing is essential in male patients receiving testosterone therapy, particularly those over 40 years of age or with risk factors for prostate cancer. While testosterone therapy does not cause prostate cancer, it may accelerate the growth of existing tumors. Lipid profiles, including total cholesterol, LDL, HDL, and triglycerides, should be monitored to assess the impact of testosterone therapy on cardiovascular risk factors. Some patients may experience changes in lipid metabolism during treatment. Liver function tests, including AST and ALT, are important for monitoring potential hepatotoxicity, particularly in patients receiving oral testosterone preparations or those with pre-existing liver conditions. Thyroid function tests, such as TSH and free T4, may be considered in patients presenting with symptoms that overlap with hypogonadism, as thyroid dysfunction can influence testosterone levels and treatment response. Healthcare professionals should establish a regular monitoring schedule, typically involving assessments at baseline, 3 to 6 months after initiation of therapy, and annually thereafter. More frequent monitoring may be necessary for patients with comorbidities or those requiring dose adjustments. Accurate interpretation of laboratory results is crucial for optimizing subcutaneous testosterone therapy. Healthcare professionals must develop a nuanced understanding of the interplay between various hormonal parameters and their clinical significance. This knowledge forms the foundation for making informed decisions regarding dosage adjustments and overall treatment strategy. When evaluating total testosterone levels, it is important to consider the timing of blood draws in relation to the most recent injection. Ideally, trough levels should be measured immediately before the next scheduled dose. For most patients, the target range for total testosterone should fall within the mid-normal physiological range, typically between 400 to 700 nanograms per deciliter. However, individual patient factors and symptoms should always be taken into account when interpreting these values. Free testosterone levels provide valuable insights into the bioavailable hormone fraction. While reference ranges may vary between laboratories, a general target is to maintain free testosterone levels within the upper half of the normal range. This approach often correlates with optimal symptom relief and minimizes the risk of overtreatment. SHBG levels should be interpreted in conjunction with total and free testosterone measurements. Elevated SHBG may necessitate higher total testosterone levels to achieve adequate free testosterone concentrations. Conversely, low SHBG levels may require careful monitoring to avoid excessive free testosterone levels, despite normal total testosterone. Estradiol levels should be maintained within a physiological range, typically between 20 to 30 picograms per milliliter for male patients. Levels consistently above 50 picograms per milliliter may indicate excessive aromatization and warrant consideration of dose reduction or the addition of an aromatase inhibitor. Hematocrit values should be closely monitored, with intervention typically recommended if levels exceed 54%. Strategies to address elevated hematocrit may include dose reduction, increasing injection frequency, or therapeutic phlebotomy in severe cases. PSA velocity, or the rate of change in PSA levels over time, is often more informative than absolute PSA values. A PSA increase of more than 0.75 nanograms per milliliter per year, or a total increase of 1.4 nanograms per milliliter over any 12-month period warrants further investigation. Lipid profile changes should be interpreted in the context of overall cardiovascular risk. While testosterone therapy may lead to modest reductions in HDL cholesterol, it often improves other parameters such as triglycerides and LDL particle size. When adjusting subcutaneous testosterone dosages, a stepwise approach is recommended. Typically, dose changes should not exceed 20 to 25% of the current dose at any given time. After each adjustment, a minimum of 6 to 8 weeks should elapse before reassessing laboratory parameters to allow for stabilization of hormone levels. Healthcare professionals should also consider the frequency of injections when optimizing therapy. Some patients may benefit from more frequent lower-dose injections to maintain stable hormone levels and minimize side effects. It is crucial to correlate laboratory findings with clinical symptoms and patient-reported outcomes. In some cases, laboratory values may fall within target ranges, but patients may continue to experience symptoms of hypogonadism. In such instances, further investigation and potential adjustments to the treatment plan may be necessary. In the initial weeks of therapy, patients should be monitored closely for any immediate adverse effects. These may include injection site reactions, allergic responses, or rapid changes in mood or energy levels. Establishing open communication channels between the patient and healthcare team is essential for prompt identification and management of any issues that arise. When interpreting early results, it's important to consider both laboratory values and clinical symptoms. Target total testosterone levels typically range from 400 to 700, with free testosterone in the mid to upper normal range. However, these targets may be adjusted based on individual patient factors and response. Based on the initial follow-up results, dose adjustments may be necessary. If testosterone levels are suboptimal or clinical symptoms persist, a modest increase in dose, for example, 25 to 50 milligrams per week, may be warranted. Conversely, if levels are supraphysiological or side effects are present, a dose reduction should be considered. Assessing clinical response and long-term monitoring and follow-up strategies. In addition to laboratory values, assessment of clinical response is crucial. Improvements in libido, energy levels, and mood are often early indicators of successful therapy. However, changes in body composition and bone density may take several months to become apparent. Effective long-term monitoring and follow-up strategies are essential for ensuring the continued safety and efficacy of subcutaneous testosterone therapy. Healthcare professionals must establish a structured approach to ongoing patient care, balancing the need for regular assessments with practical considerations of patient convenience and healthcare resource utilization. A typical monitoring schedule for patients on subcutaneous testosterone therapy involves more frequent assessments during the initial phase of treatment, followed by less frequent but regular follow-ups once stability is achieved. During the first year of therapy, laboratory evaluations are often recommended at baseline 3 months, 6 months, and 12 months. Subsequently, annual assessments may be sufficient for stable patients with more frequent monitoring for those requiring dose adjustments or experiencing side effects. Comprehensive annual evaluations should include a battery of tests to assess overall health and treatment efficacy. These typically encompass total and free testosterone levels, estradiol, SHBG, complete blood count, CBC, comprehensive metabolic panel, CMP, lipid profile, PSA, for men over 40 or at risk for prostate cancer, and thyroid function tests. Additional tests may be included based on individual patient factors and risk profiles. Between annual assessments, healthcare professionals should consider implementing interim check-ins, which may be conducted via telemedicine platforms. These sessions allow for discussion of symptom changes, medication adherence, and any emerging concerns. They also provide an opportunity to reinforce patient education and address questions that may arise during treatment. Prostate health monitoring requires particular attention in male patients receiving testosterone therapy. In addition to annual PSA testing, digital rectal examinations should be performed regularly, typically on an annual basis. Any significant changes in PSA levels or prostate texture should prompt further investigation, potentially including referral to a urologist. Bone density assessments and cardiovascular risk assessments. Bone density assessments may be performed every 1 to 2 years, particularly in patients with risk factors for osteoporosis or those who initiated testosterone therapy due to bone health concerns. Dual energy X-ray absorptiometry or DEXA scans can provide valuable information on bone mineral density changes over time. Cardiovascular risk assessment should be an ongoing process throughout testosterone therapy. Regular evaluation of blood pressure, lipid profiles, and markers of insulin sensitivity is crucial. For patients with pre-existing cardiovascular risk factors, more frequent monitoring and collaboration with cardiologists may be warranted. Patient-reported outcomes should be systematically assessed at each follow-up visit. Validated questionnaires, such as the Aging Males Symptom Scale or the Androgen Deficiency in Aging Males Questionnaire, which are both available on the GlobalRPh website, can provide structured insights into symptom improvement and overall quality of life. Adherence to therapy should be regularly evaluated, with healthcare professionals inquiring about any challenges patients may face in maintaining their treatment regimen. Issues such as injection site discomfort, scheduling difficulties, or concerns about long-term effects should be addressed promptly to ensure continued engagement with therapy. Periodic reassessment of treatment goals is essential, as patient priorities and health status may evolve over time. Healthcare professionals should engage in ongoing discussions about the benefits and potential risks of continued therapy, allowing for shared decision-making regarding long-term treatment plans. Monitoring for potential long-term complications of testosterone therapy is crucial. While the overall safety profile of testosterone replacement is favorable, vigilance for rare but serious adverse events, such as venous thromboembolism or sleep apnea exacerbation, is necessary. Healthcare professionals should stay informed about emerging research and guidelines related to testosterone therapy. Regular review of the latest literature and participation in continuing education activities can ensure that monitoring and follow-up strategies remain aligned with best practices. Coordination of care with other specialists, such as urologists, endocrinologists, or cardiologists, may be necessary for some patients. Establishing clear communication channels and collaborative care plans can enhance overall patient management. Patient education should be an ongoing process, with regular reinforcement of key concepts related to testosterone therapy, potential side effects, and the importance of adherence to monitoring protocols. Providing written materials or directing patients to reputable online resources can support this educational effort. By implementing comprehensive long-term monitoring and follow-up strategies, healthcare professionals can ensure the continued safety and efficacy of subcutaneous testosterone therapy while adapting treatment plans to evolving patient needs and emerging clinical evidence. Conclusion: subcutaneous testosterone administration represents a significant advancement in the management of hypogonadism, offering patients a convenient and effective treatment option. However, the success of this therapy hinges on meticulous laboratory monitoring and expert interpretation of results by healthcare professionals. By understanding the nuances of subcutaneous testosterone pharmacokinetics, implementing comprehensive testing protocols, and skillfully adjusting treatment based on both objective and subjective measures, clinicians can optimize patient outcomes and minimize potential risks. The landscape of testosterone replacement therapy continues to evolve, with ongoing research shedding light on long-term effects, optimal monitoring strategies, and potential adjunct therapies. As such, healthcare professionals must remain committed to lifelong learning and adaptation of clinical practices to align with the latest evidence-based guidelines. Ultimately, the goal of subcutaneous testosterone therapy extends beyond merely normalizing hormone levels. It aims to enhance patients' overall quality of life, addressing the multifaceted impacts of hypogonadism on physical, emotional, and cognitive well-being. By adopting a patient-centered approach that combines rigorous laboratory monitoring with attentive clinical assessment, healthcare professionals can guide their patients towards achieving optimal hormonal balance and improved health outcomes. As we continue to refine our understanding of subcutaneous testosterone administration, the future holds promise for even more personalized and effective treatment strategies. Through ongoing research, clinical experience, and collaborative efforts within the medical community, we can further enhance our ability to provide high-quality care for individuals with hypogonadism, ultimately improving their health, well-being, and quality of life. Thanks for watching our GlobalRPh production. If you enjoyed the video and found it helpful, don't forget to smash that like button and subscribe to our brand new YouTube channel. We're bringing you a dynamic mix of content across a variety of topics, so there's always something fresh, engaging, and insightful just for you. Your support means the world to us. It helps us grow and keep delivering exciting, high-value content. Stay tuned, because the best is yet to come.